you?
That's a good question. I think it's important for parents not to overreact, because most likely the child is going to cope with that by going and self-injuring. So the first thing a parent should do is take a deep breath. And
which is real
Which
tough.
is really hard, because a lot of them, they just get angry, they want to punish, and that's the wrong reaction.
Or their care their need to care is so high that perhaps they move too quickly in one direction or the other.
Right, or they want to remove everything sharp out of the house.
Okay.
Which is not recommended. If somebody's at a point where you need to get rid of everything sharp, they need to be in the hospital.
Okay.
So they can have the conversation with their child, say, I'm noticing these scars, let's talk about what's going on. Let me take you to somebody, you know, let's get you to somebody who specializes in this, and let's get you help.
Would there be an initial reaction on the part of the child to not want to do that?
Usually at some point they want the help, which is why, for whatever reason, they might have subconsciously exposed a scar.
Okay.
But they can also feel very shameful of the behavior and avoid it, which is why it takes usually 2 years before a parent even to know that it's going on.
Let's say then that it's all discovered. What's the treatment look like?
The treatment looks like it's really trying to meet the patient where they're at, the individual, and encourage them and empower them to want to lead a life free of self-injury. So it's looking at what has the self-injury, what consequences has it caused, how has it affected relationships, how has it gotten in the way of engaging in activities that you enjoy, what would it be like going and applying for a job covered in scars. And self-injury isn't just among adolescents. It doesn't discriminate. Children, old adults, male, female, all races. And so it's getting to know them and finding out what function the self-injury has served.
Well, it occurs to me too that if
the self-injury has served.
Well, it occurs to me too that if that first inclination to self-injure, it still doesn't deal with those underlying motivations, and though those can then crop up in any time that is particularly stressful, and the behavior can return.
And what I explain to parents is that most likely when a child is working on not self-injuring, they're going to have more urges than they usually do. But the individual shouldn't be scared of the urges, because if you think of when your stomach growls, your body's telling you that you're hungry, or when you yawn, your body's telling you you're tired. When you have an urge, your body is not telling you you need to self-injure. It's telling you something's going on, and you need to look at it.
And there is help. So once it's determined that that the activity is discovered, inpatient, outpatient, what might be some relatively normal treatment programs? Do they all involve hospitalization?
They don't all involve hospitalization. In fact, self-injury really in itself can be managed on an outpatient basis. There's different tools and groups that you can utilize in that. If it gets to a point where it's out of control, where somebody can't stop self-injuring, it's going all the time, and it's mixed with mood disorders, which we see oftentimes, and somebody's mood is unstable, their level of desperation and impulsivity becomes worse, and that's where the risk of suicide comes in.
Could this behavior be presaged by behavior at the age of 8 or 10? I mean, in discovering somebody self-injuring at 13 or 15, is it possible, looking back, that there were some indicators of this behavior earlier?
It's possible. A lot of times the people who self-injure don't have a language for talking about feelings. So they might act out in other ways to try to express the emotional pain that's going on inside, to try to communicate.
We're getting a wrap up, and what I really want you to tell now is where you go for help if you're a parent or somebody who's self-injuring.
Sure, definitely. You can go to our website, which is www.pediapsych.com.
PediaPsych?
PediaPsych.
Okay.
And we have a special section just for people that self-injure and for getting more information on self-injury. We have a log on the page, which is a really great, useful tool for people who are self-injuring to identify triggers, help to challenge emotions, thoughts, unrealistic expectations right in the time. Or they could call our practice directly, 703-841-1290, and speak with Lauren to set up right away an assessment.
Or Dominion Hospital.
Or Dominion Hospital. You can call First Step in Admissions to get some help on that.
Rebecca Berman from Dominion Hospital. And also tell us the name of the other firm that you're connected to.
Columbia Associates in Psychiatry.
Columbia Associates. Thank you so much. This is a tough topic, but you've given us a lot of super information, and we appreciate that. Thank you for listening and watching. This is Health Focus, brought to you by HCA, the Hospital Corporation of America. I'm Ann Rodriguez, your host, and we'll be with you next month on Health Focus.